Hey everybody, good morning. Welcome. Hope you're having a great day today. Going to go over some interesting information that we've been coming up with. And one of the big things that is in the news the last couple days is Pfizer. Pfizer, the drug company, has come out with a vaccine that is going to get emergency use approval, it looks like, and they're saying that it has a 90% effective rate. So what does that mean? What does this tell us? And what does it mean for you? And what are you going to do about the vaccine? So first of all, let's talk about traditional vaccines and what they've done over the years as far as measles and chickenpox and polio and all these different things. So traditionally, vaccines have been hey, let's give them a small dose and get the body to create this little bit of a reaction, create antibodies, some different things, and then the body will not fight off, or it will be able to fight off, and it won't get that whatever virus, pathogen, whatever it is down the road. What we're seeing now with the COVID-19 and the coronavirus that we're looking at is that they're working on a messenger RNA vaccine. Messenger RNA has never been done in a broad range for the human species. So this is a new type of vaccine, and it actually affects the DNA and does some other things more in depth on the scientific side than we have to get into today. So we have a new type of vaccine. Last I saw was like 30 different companies were trying to kind of basically beat everybody else to the market, this warp speed deal that they're doing. And so now we're looking at Pfizer says, hey, we have this study, 90% effective, let's get it out to the masses. Pfizer's predicting that they are going to be able to do 50 million doses in 2020 and 1.3 billion in 2021. Hey, Danda, good to see you there. Thanks for your feedback on what you're thinking of doing with vaccines. If you guys are jumping on board, go ahead and drop me a message down below. Tell me hi, tell me what you're thinking about it, if you've read about the studies or anything like that. So basically what happened was Pfizer enrolled 43,538 people, and half of them got the COVID vaccine that they're working on, and the other half did not. They were in the placebo group. And then they've tracked those people. So the vaccination that they're working on that Pfizer has, it's a two-step vaccine. So you have to get it on day one, and then day 21, you have to get another injection. So that's one of the big concerns that a lot of the people in the vaccine world have, is that most people are not going to go back and get another one. They have a hard enough time just giving somebody a flu shot once, let alone getting them to go back in 3 weeks. Most people don't even remember to change their oil on time, let alone get another vaccination. So that's one of the problems with this type of vaccine, is that they're going to have to do that. So here's what happened. 43,538 participants, and good to see you there, Doris. And what has happened and where this 90% has come from, they've gotten up to 94 confirmed cases out of that 43,000 people, almost 44,000 people. There have been 94 confirmed cases, which I'll get onto in a second, which is kind of interesting that, hey, Diana, good to see you out there, which is kind of interesting that that's all that has actually had a true infection. Out of 44,000, I did the math, that's like 0.2% of that 44,000 have actually had a COVID infection, which, if anything, just tells us that this is way less number of people that are getting truly infected, because I guarantee you what's not happening is they're not going and just testing these people randomly throughout the week and just testing PCR tests, because if that happened, we would see way more numbers of people getting positive tests, just like we're seeing out in the general public. So here's what's happened. They were waiting for people to get symptoms, and 94 people have gotten symptoms out of that 44,000. And so where that 90% comes from is that 90% of that 94 were not vaccinated, 10% were vaccinated. So basically you've got 44,000 people, half of those people were vaccinated, half of those people were not. 94 of that total amount had a positive, hey Nicole, 94 of those total 44,000 people had a positive test, positive COVID test, and an actual infection. And 90% of those were not vaccinated. So that 90% effective comes from the thinking that, oh, well, 10% of the people that were vaccinated or of the people that got infected were vaccinated and 90% were not. So this gives us a 90% effective rate out of 94 people. So when I saw that, I was like, really? We're gonna give this out to billions of people based off of 94 case sample size, and they're basically going to get up to it was 100 and what was that one? 164 is what they want to get up to as far as the total number of this in this study, number of people that actually get infected. Good to see you out there in Kansas, Virginia. Hope you guys are having a great week. So what we're looking at is 94 people got an infection out of 44,000. So the thing that tells me right off the bat is this is not that prevalent of a disease to begin with. And this is what we've been looking at all along, in that if somebody's not doing tons and tons of PCR testing, which we know has lots of false positives, you're not going to see that large of a percentage. And so even out of the people that were not vaccinated, it jumped up to 0.38% of those actually had a COVID infection. They did not say that anybody died from the infection. They didn't say that anybody had serious disease or anything like that. So that's the first thing that jumped out at me at this study. The second part was that it was such a small number to begin with, and they're going to be giving this out to billions, not a few thousand or millions or whatever, but billions of people by next year, and that we truly don't have this huge definitive 20,000 in cases showing that one way versus the other. We're going off of 94 cases of actual infection, and that only 90% of those were non-vaccinated, 10% were vaccinated. So pretty interesting. This is Pfizer. Pfizer is a drug company. Their revenues are $52 billion a year. They make different medications like Zoloft, Glucotrol, doxycycline, Viagra, some of these different medications. And really interesting, I did a little research on Pfizer, and they've had about $4 billion worth of fines placed on them in the last 15 years. And one of the big ones was a few years back. It was $2.3 billion fine, and that was for drugs like Lyrica and Xerox, or Xyrox is how they say it, pain medication, and they got fined $2.3 billion for illegal marketing. So, that was kind of interesting. It's like, wow, so Pfizer, can we trust anything that they're saying at this point? I don't know. That really puts me into a kind of doubting place, whether vaccines work or not, and whether you want to get a vaccine or not through this. Pfizer just doesn't have a great reputation for being honest to the consumers, so hard to really know what's going on out there. But just educate yourself on this. Remember, just like we've talked about time and time again, you've got to get your immune system up. You've got to get your immune system strong. Your D, your A, your C, have everything on hand for your hydrogen peroxide, and you're going to nebulize that. Do all these different things to have your body and have it ready to do this, because it's not just about COVID. Looking at those statistics, 44,000 people, only 94 actually got an infection. Hey Gilda, good to see you, and we're going to keep you strong there. Don't worry about that. it's really, basically it's telling us it's not as prevalent as everyone is saying, because if it was, you would be seeing way more about, even like 10% or 20% of these people would have the infection, but we're at 0.38% of the non-vaccinated people have had a COVID infection. So pretty darn low, not the pandemic that we were talking about originally, and this is what we've been saying all along. So remember, educate yourself, get your body as strong as possible, and really look into what a messenger RNA vaccine is. If you feel comfortable that going into your body, great, go ahead and do that. Research into who and what Pfizer is. If you feel comfortable with them putting that into your body, great, go for it. If you don't, come up with alternatives, come up with other options to get your body as strong as feasibly possible, and keep yourself healthy, which is going to do way better than any amount of social distancing or face masks or anything along those lines. You've got to keep your body as strong as possible. Research shows if you get your vitamin D up over 50, decreases the rates of infection by over 50%. So you've got to take charge. You've got to be in control. There's no amount of government intervention. That was the funniest thing when the presidents were arguing back and forth, and I could have done it this way, I could have done it that way, and it's like, you know what? There's no amount of government that's going to protect us, no amount of medication, no amount of vaccine, whatever. You've got to take that personal responsibility for your health. So hopefully you guys learned a little bit. Research Pfizer, research messenger RNA vaccinations. The 90%, remember, 90% out of 94 people did not have the vaccine, 10% did have the vaccine. That's where that 94% is coming, or that 90% is coming from, out of 94 total cases. So for me, I'm not looking at that as definitive yet. Still has to be a lot more information coming out, but we'll see. They're pushing a lot of different companies are going to be coming out with different stats and studies. But just keep educated, keep yourself strong, and make it a great day.